All right, thank you very much, Ben Troy Njue. We will be getting in touch with him even as we continue with this, show. This is KBC, where we give you information as they trickle in. Remember, that is just with regards to the arrest of top government officials, including the CS Rotich, with regards to lack of accountability. Remember, we have around 46 billion shillings that was supposed to be used. Yes, and yet an additional of 17 billion was, acquired, leading up to 63 billion shillings. Well, we shall be keeping you in touch with that, even as you continue. Keep it. Good morning, Kenya. But now we shift gears into matters health. This morning, I am joined by Dr. Cecilia Warero. She is a public health practitioner. Karibu sana, Daktari.
Asante.
Welcome to Good Morning, Kenya. This morning, we shall be putting matters health into perspective, specifically hepatitis. This is one disease that is common and seemingly most people have it, yet they do not know. Keep the hashtag going on Twitter at KBC Television. That is our official handle. Tag me at Ramaguko. My colleague's handle is at Jane Wambui. Hashtag Good Morning, Kenya. Your Twitter handle, are you on Twitter?
Yeah.
Yeah? What's your Twitter handle?
Just my name's Cecilia Warero.
Warero. Tag her too, even as you send in your questions concerning hepatitis. And specifically, we'll be talking about hepatitis B. All right, so Cecilia, what is hepatitis just by definition, just for someone who may not know about it? And what are the common types that exist so far?
Okay. Thank you very much, Ram, for having me. Thank you to KBC. I think hepatitis is basically an inflammation of the liver. Mm-hmm. When you say hepatitis, the liver cells are called hepatocytes. So the inflammation of those hepatocytes is what is termed as hepatitis. Okay. So that is now where the term hepatitis comes from. But as you have rightly said, there are various types of hepatitis, and there are various causes of this hepatitis. Because hepatitis can either be non-infectious or infectious. Okay?
So what causes hepatitis?
Okay, as defined, it is an inflammation. So any irritation to the liver and the liver cells will result in the inflammation of it. If it is irritated by either maybe alcohol or maybe some toxins, these are now what we're talking about, non-infectious hepatitis, okay? In that it is caused by non-infectious products. Okay. What you can take, what you're ingesting. For example, when you people talk about maybe some poisonings, when you talk about aflatoxicosis, one of the things that happens is that the liver gets inflamed and it interferes with the proper functioning. And that is one of the things that causes the body to malfunction, and the side effects of all the infections from ingested products, okay?
Okay, so mostly it's all about what you take in, the food you ingest.
That is for the non-infectious hepatitis.
All right.
Okay, so even when you're, if you drink a lot.
You can even use oil, no problem.
So if you drink a lot. So if you drink a lot, and then you develop liver cirrhosis out of that. So that is still part of hepatitis. Yes, okay. But it is not infectious.
But then most people don't know that they are infected with it. Reading some statistics that some may not even have the symptoms, and thereafter they never even get to seek medical attention for even about 20 to 30 years.
Yeah, so now we're going into what we talk about infectious infectious hepatitis, which is hepatitis that is caused either by virus or by bacteria. But primarily now we're talking about hepatitis. There's hepatitis A, B, C, D, and E. Okay. So hepatitis A and E are caused by, are actually not sexually transmitted. These are either by ingesting food that has either been contaminated, or somebody who has the disease and maybe has contaminated the food, and you eat the food and you get the sickness.
Oh, okay. So here we get the difference between hepatitis A. What differences do we have there? Hepatitis A, B, C, D, and E. Is there a difference between these?
Absolutely, absolutely. So A and E are more to do with what you're eating. And it results primarily in diarrheas and things like that. Okay. Because it's just a matter of health and hygiene, your hygiene practices. So if you're not hygienically preparing your food, if you're not hygienically handling your food, if somebody who has hepatitis A handles the food, and you also now indulge in it, then you're more likely to pick it up. Okay, so that is
just by handling food.
It's the same way, for example, if someone has cholera, typhoid, and they have the disease and they are able to transmit it through the various...
They should not cook. They should not
you need to handle your food carefully. Do not, once you prepare the food, then, you know, people have this habit of chota, apana, pika, leave it. The heat that has cooked that food is going to be, it's not that just because they're touching it and preparing it, no. Okay. But once it is prepared, it should be served in a correct and clean, hygienic manner. Apana, tunaonja alafu apana, achana na hiyo.
Tuache kuonja chakula.
Hapana, achana nayo. Ukionja, sisemi usionje, nasema onja, lakini hiyo kijiko ambayo umetumia usirudishe hapo. Onja, weka kando hiyo, osha hiyo kijiko.
Uoshe.
Kama ama onja hivi, chukua kwa kijiko, weka hapa. But that is only for A and E.
Okay.
Now, when we're talking about hepatitis, now the more very virulent and more impactful hepatitis, we're talking about hepatitis B, hepatitis C, and hepatitis D. When you look at hepatitis, I think everybody just thinks, it's just an inflammation of the liver.
Yeah.
But it is more than just that.
It is more serious than that.
It is extremely much more serious than that. And I think there has been a lackadaisical approach to it because everybody's just, you know, relaxed about it. Oh, it's just hepatitis, whatever, you know, and you keep moving. But hepatitis B, C, and D are sexually transmitted diseases.
B,
C, and D.
Are sexually transmitted.
Yes. So, okay, as it stands right now, hepatitis B and C, they're all sexually transmitted or through blood and body fluids. But however, hepatitis C, fortunately, can be treated and cured.
Okay.
Hepatitis B, on the other hand, has no cure as of now.
All right, so you know, this is quite a lot of information at the same time. Okay, so let us. I would like us now to get over to hepatitis B. Okay, because I'm getting that now. Hepatitis C, B, and D sexually transmitted.
Yes.
But now, looking at B, does hepatitis B have the ability to be spread from one person to another without someone knowing?
Well, if I'm having sex with you and you have hepatitis, or if I have hepatitis, absolutely you would know. The signs are not obvious, okay? And it's not like you'll walk around and somebody will see and say, oh, that person has hepatitis. The hepatitis signs and symptoms may include, they may include fatigue, they may include jaundice, they may include high fever or something, but this is much, much later when the disease has progressed. But in the early stages, you'll barely notice that this person has hepatitis. So is that a different case compared to C and D? No. In fact, for hepatitis, okay, let me just explain something.
Okay.
Hepatitis D, more often than not, only attacks you once you have hepatitis B. It needs the proteins from the hepatitis B virus for you to ride on, and so it makes even the infection even more aggressive. But for hepatitis C, more or less the same similar symptoms, because you know that it is affecting the liver, yeah? So you'll have similar symptoms that would be presenting. However, for hepatitis C, more often than not, you'll find that hepatitis C will more often than not occur together with HIV, more often than not.
C?
Yes, hepatitis C. And the only beauty of hepatitis C is that you can get treated and cured, okay? But hepatitis B, unfortunately, does not have a cure. As of now, there's a lot of research going on. The same way we hope that we'll get a cure for HIV is the same way we hope that we will get a cure for hepatitis B. But as things stand right now, you get hepatitis B, you're subjecting yourself to a lifetime of infection and a lifetime of having to take medications, antiretroviral medications.
Okay. How dangerous can hepatitis B get if someone has it? And do you have any signs and symptoms that someone should look out for?
Signs and symptoms, as I mentioned, fatigue, jaundice, or yellowing of the eyes, because your liver is not affected. You know that the liver is where you have the bile and all that, and if the production system is being blocked or is being interfered with, then you'll result in the jaundice. There's also fever. But you see, these are general signs. Like if I tell you I'm having a headache, I'm having fever, I'm tired, It could be someone will tell you, oh, labda kuna malaria.
Yeah, and that's why I'm even being specific here concerning B. Is there something specific that someone should look out for? Because any headache can mean anything. It can mean any fatigue can mean anything. But now, should I be afraid every time I get a headache?
No, absolutely not. What we are saying is hepatitis B is endemic in Kenya. It is very common in Kenya. You can imagine, as of now, the prevalence of HIV has gone down to about 4.8%.
Yeah.
But for hepatitis B is at around 8%. So that means more people have the disease, but they're working with it and nobody knows about it.
In fact, research says that hepatitis B is 100 times more infectious than
it
HIV.
Yes, thank you very much for pointing that out. Can you imagine? And worse still, hepatitis B lasts for 7 days outside of the body.
Outside,
7 days.
without dying.
Yeah.
The virus.
Absolutely. So the infectivity of that virus is so high. It is very prevalent within the community, but yet people are walking around thinking that they're okay.
Are people aware about hepatitis B in this country?
And that is why we're here today. We're going to talk about it because this week is what I would call the Hepatitis Awareness Week. Hepatitis Day is celebrated, World Hepatitis Day is celebrated on 28th July, which is Sunday.
Sunday?
Yes, it's on a Sunday. But internationally, that is the date on which we celebrate hepatitis. And I think this interview has come at a very important time and at a very opportune time because it is time that people spoke about this disease. There is no point in people finding themselves that all of a sudden, oh, I have been diagnosed with hepatitis B, and oh my goodness, I am going to have to take antiretrovirals for the rest of my life. And, you know, if the challenge right now is, people are walking out there with the disease. One, if someone doesn't know that they're infected, as the time goes by, there's what you call liver cirrhosis. Okay, it's just basically as the virus continues to replicate in your body, in the liver, it affects the functionality of the liver parenchyma.
Of which most people believe that, okay, we have an association between taking lots of alcohol and liver cirrhosis. Is there a connection?
Yeah, so don't get lost in that. Remember when we started, we said
yes.
there's the infectious and the non-infectious. Remember, and we said the non-infectious are those including the alcohol intake or the poisonings, toxins. Okay, so we left that aside and we came to the infectious. Okay, where we've spoken about the viral hepatitis through the various 5 of them, right? Yeah. So when someone hears hepatitis and liver cirrhosis, and they're thinking, oh, I don't take alcohol, or oh, my alcohol intake is manageable.
Then they think that they're good, that
and
they're
they think
safe.
that they're good. No, you're not good. I'm telling you, no, you're not good. You need to be tested. Hepatitis B does not show up the symptoms are very subtle. By the time the symptoms are showing up, then it means that your liver has really taken a beating. Okay.
But then, how young does or old does it have an effect on someone in terms of the age? Is it more prevalent for the young or the old? Where is it more infectious?
So what happens? Hepatitis, once you're exposed, once you're exposed to the hepatitis virus, either maybe at childbirth, or maybe during sex, or maybe through blood transfusion, then if you're lucky, your body can fight the infection. That is during an acute phase of infection, your body can fight the infection and clear it. But if the virus is present in your system beyond 6 months, then it means that you have a chronic infection. And that means that then you'll be said to be a carrier or chronically infected with hepatitis B for the rest of your life.
Okay. What if a pregnant woman has hepatitis B?
Oh, that's no problem at all, because the child within 24 hours of being given birth to can be given a shot to prevent them, a vaccination against the hepatitis virus.
So that is whether the child is whether it's born or unborn?
Yes. A pregnant woman can be given a shot of hepatitis, and that will be able to protect her within as she goes on ahead with her life, if she's not infected. If she is infected, at the point of birth, the child can be given a shot within, as soon as possible after the birth, such the child gets now protection, starts building its immunity against the disease. With
which this is a risky period here.
It's very risky.
After giving birth.
It's very risky. it's very, very risky. So now we're saying that the various routes of transmission, if you're having sex carelessly, and we all have sex, no? I think as adults, people are having sex everywhere. And if you're having sex with every Tom, Dick, and Harry, and Jane, Sue, and Anne, and you're not careful, you will get hepatitis B. If the person that you're having relations with has the disease.
Right.
But why should you go through that? And there's a vaccine. Why should you go through that?
And that is a problem that we have in the society. Yeah, most people tend to have premarital sex, especially in this time and age. We had last year issues to do with teenage pregnancies.
Yeah.
Most of the ladies even dropped out of school before their national examinations.
Absolutely.
It's a crisis.
It is a crisis. We cannot pretend and bury our heads under the sand and say, we cannot talk about hepatitis B, or we cannot talk about sex because, we'll be corrupting the children. No, these children are like much more exposed than we are, than we know, and therefore they may be engaging in risky practices. So exposing themselves to sex very early, picking up the disease and having to live with it for a very long time. So I think it's just very important that this increased awareness and also access to facilities like services for testing and for vaccination.
And then, and we should touch on that later on, even as talk about whether we have sufficient facilities in the country to cater for this. But now back to the issue of pregnancy. You said that the baby needs to be given an injection immediately after being given birth to.
Absolutely.
But now what happens if the baby is not given an injection, or what happens when the baby gets infected with hepatitis?
Then they'll carry it for the rest of their lives. Because you see, when a child is born, their immunity hasn't yet developed. Unless prior to the birth, the mother had already been given a shot or a vaccination against the hepatitis, then probably the child can be protected. Or if the woman does not have hepatitis, then the child can be safe. But if a child is born and doesn't get the shot, but I think you know the schedule of the vaccinations. Usually given at birth, then at about 6 months. 6 months, 9 months, 12 months. No. It's an interval of about 6 weeks. Then another 1.5.
The BCG vaccines and the rest.
Yes, but specifically for HPV.
HPV. Okay.
Yes. So the HPV is given at about 6.5 weeks. Then about another month later, it's given, and then a third dose is given again. So it's at intervals of 3 months, of a month each. It's a three series dose.
After 6 months, then after 1 month?
After you're given at birth.
At birth.
Then at 6 weeks.
6 weeks.
Then after 1 month.
All right.
And then after another month.
Okay.
Yes, for the children. As an adult, you can still get your vaccination done if you did not get it.
But still, just explaining more on the vaccination, do we have even some that can be administered at later stages?
Absolutely, absolutely. Even you, as an adult right now, can go and get your vaccination done. Okay. Because the vaccine is available for both children and for both adults. So children are given about 0.5 mils of the vaccine, but adults are given about 1 mil of the vaccination. But it's not a one-shot vaccination. You get a three series vaccination where you're given one. Let's say if you get it today. Today is what date? Today is
23rd.
So 23rd. Then 1 month later, again, you go for the second. Yeah. Then 6 months later, you get the third vaccination. You need to get the whole series of 3 vaccinations so that you can be able to develop the full immunity against the disease.
Okay.
Yeah.
But now, let's get now to treatment. Is there any means of treatment for hepatitis B that exists so far? And for people who are out there, what should they look out for?
Okay. Hepatitis B, as of now, does not have any known cure. There is no known cure for hepatitis B. You will have to take antiretroviral drugs for the rest of your life.
All right.
So if you do not take those drugs, you are likely to develop cirrhosis, and also ultimately you'll get liver cancer. We all know that the liver is a core organ in our bodies.
So the solution is the ARVs. Huh?
If you get infected, then you'll have to be on ARVs for the rest of your life. So why would you want to subject yourself to having to, one, not only having your liver being messed up in its function, but also risking yourself to get liver cancer? Because it has been proven that about 2/3 of every patient who has liver cancer is actually a HBV sufferer. You understand? Oh. So 2/3 of every liver cancer patient is actually a HBV sufferer. Why do you want to subject yourself to that? Because ultimately then you know you're going to die, right? So if
and that's the belief here. Most people see that hepatitis B now is like a death sentence.
Okay, it shouldn't be a death sentence. The same way when you have HIV, you take your antiretrovirals and you still live a full life, you know? So it shouldn't be a death sentence. But the fact is, if you know that you can prevent it, why not take those measures to prevent it? Why not go and get tested and get your vaccination and sit pretty and know that I cannot be exposed to this disease? Or even if I'm exposed, because what vaccination does is it wakes up the soldiers in your body to fight. So once you get your vaccination, even if you're exposed to the virus, your body soldiers are already ready to fight with it, and therefore it has no effect on your
so you're
body.
more aware of what's
your body
happening.
System is already aware. Yes, your immune system is already awake, and it'll fight any infection. Yeah. But if you just sit around and think, oh, hepatitis, oh, it's just my drinking, oh, it's my wet, I can get by. No. Yeah.
And as a country, then back to what a point you alluded to earlier on, do you think we have the proper facilities when it comes to
Indeed we do. Indeed we do.
You do?
We absolutely do. It's just that I think there's a total lack of awareness and a lack...
There is some disconnect somewhere.
Absolutely. That is the point. These facilities, you can get tested in any of the public health facilities in the country. If you go to the Kenyatta hospitals, if you go to Mbagathi, if you go to whichever hospital you choose to go to, you'll be able to get your tests done. Now, the tests vary in cost. It's the same test that's being done, but depending on which hospital you go to, the cost of the testing will be a little different.
But it's not pocket friendly regardless of wherever you go to.
It is perfect.
Is it?
So I would say if you go to Seme, if you go and eat lunch at Hilton and I go and eat lunch at the Kibanda, and it is the same githeri at Hilton that has been labeled a certain way, and me I go and eat the githeri, haven't I eaten the same githeri? It's more or less the same githeri, isn't it? Githeri ni githeri. Like you will pay for Hilton the rate of Hilton, and you will pay for the Kibanda the rate of the Kibanda. So choose your poison.
All right. So choose your poison.
Choose your poison.
Do you believe that we even have the proper manpower? Doctors, facilitations, health practitioners like yourself?
What I'm aware of is that the government has been carrying out training for the clinicians. I know that the government has been doing training through NASCOP and KEMRI to build the capacity of the clinicians at the various public health facilities. That is there. Because it has been realized that, oh my goodness, this disease has been left alone for so long, and it is probably now time that people should begin paying attention to it. So there's training and there's awareness. And at any public health facility and at any reputable hospital, you should be able to find a reputable lab technician who can be able to do for you the test. If you speak to a lot of lab technicians, they'll tell you there's so much of hepatitis B. Every time they get to hear, whenever they're doing tests, either just a battery of tests or someone has come in to actually just test, they find that there's quite a bit of hepatitis B, but no one is talking about it. Why are we not talking about this disease that is preventable? Why are we not talking about it? That's my question. Why are we not talking about it?
Preventable yet incurable.
Yeah, so if it is, and that's the paradox. That's the paradox of the entire situation, because if it is incurable, yet you know that I can prevent this disease, why are we not doing more? That's the question I'd like to ask.
The Big Four agenda. We have universal health care.
Yeah.
Do you believe that at some point it is going to help in creating awareness to the public and helping in terms of making sure that the public prevent themselves from getting hepatitis B and also have the proper facilitation and manpower, and they have their awareness in general to look out for this disease?
Now, it also depends on where the priority of the government is in the way of diseases. Because maybe the priority is in malaria or in HIV, and hepatitis B is somewhere hapo chini.
Yet hepatitis exceeds
yes,
HIV.
Yes, as we have said.
But they are also aware of that, aren't they?
So the question remains, and the question begs, why? Why are we not talking about hepatitis B? Hepatitis B, as you have rightly said, is 100 times more infective than HIV. Hepatitis stays in the environment for 7 days. Equally, like HIV, hepatitis does not have any cure. But you can prevent it. The cost of testing and vaccination pales in comparison when you look at the cost of not only just once. Okay, you see, when you go to do a test, you get the first basic test, confirmatory test, which is the HBsAg, to check the antigen, okay? When the virus is in your body, it produces its own proteins, and that's what is picked up when they do the first test, okay? The HBsAg. So once you do that, if you're free, then you can get vaccinated. So depending on which hospital you go to, that initial test can cost you either 1,000 shillings, and then you go and get your 3 series vaccination, because each vaccination is 1,000. So that will be, if it's 3, that is 3,000. So 1,000 shillings for testing and 3,000 shillings for vaccination for the whole battery.
Okay.
But if you are tested positive of HBsAg, then you have to go for a series. They have a battery of tests that they have to do subsequent to that.
HBsAg is hepatitis B.
Yes, oh yes, it's hepatitis B antigen.
Antigen.
Yes, when the virus is in the system, it produces a protein that is what is termed as the antigen.
Antigen. All right. Yes. So that's what you mean by HBsAg. All right. So if you're tested positive for that, you go for.
Now you have to go for subsequent tests. Okay. Further tests that either will help you, one, establish if the virus is still active within your body. You have to do the viral load, just the same way you do for the regular HIV test. You have to find out the viral load. You have to go and do a scan and see if your liver is affected. You have to do liver function tests, as in you have such a battery of tests subsequent to that. That can take you up to 20,000 shillings.
20,000 shillings.
And that is on the lower scale. If you go to Hilton, my hospital,
the hospital
you
Hilton.
Will pay 50, hospital Hilton, you will pay 50,000 shillings. The initial test can cost you 6,000 shillings, and I'm saying this for a fact.
What about the toll that it has on the body, on the person? Does it have any big impact?
The liver is being affected. The liver is a core organ in your body.
No, as
the liver
these medications, do they take
absolutely.
Take
I mean, what would I say? I mean, you're introducing foreign stuff into your body that is fighting fighting a foreign body in your body. So obviously there has to be some impact that you may not see, but obviously the body will, as time goes by, be affected. But the fact is that when you take the antiretrovirals, you're taking the antiretrovirals to reduce the load of the virus in your body. So that one, you're less infective to people, and two, it has less negative impact on your body, okay, on your liver. So do not sit back at home and think I'm safe. Go back, maybe visit your health practitioner, your doctor or whoever, and ask them, maybe, may I have a hepatitis test, hepatitis B?
In your own opinion, so far you've seen how we are doing things as a country. How do you see the Big Four agenda when it comes to matters health, even as you talk about hepatitis?
The intention is there. The government is taking the right direction. However, the tests that are required for hepatitis detection, I can almost be for certain say that they are not even covered under NHIF. So if you're going to cough up that 20,000 shillings for your tests, or your 10,000 shillings, I mean, your 50,000 shillings for your tests, they are not under NHIF.
20,000 is not easily acquired.
And you see, unlike HIV drugs, which you probably, under the CCCs, the Comprehensive Care Centers, you may be able to get them at a subsidized rate, okay? Or even totally free.
Okay.
For hepatitis B, you're not covered under that. Yet, it's the very same drugs that you're going to be taking, okay? And in fact, okay, the beauty for hepatitis B, you see that more often than not for the HIV, you'll be taking a battery of 3 drugs. But with the hepatitis B, of those 3 drugs, you only need 1.
You know, even as you look at cost effectiveness, not everyone can be able to acquire that amount of money.
And that's the fact.
The common money.
So you see, the thing is, it goes across the board. It's not just the economic aspect. It's also the health aspect. It's also, you know, the social aspect.
All right.
You start feeling, okay, I'm not worth it and all that stuff. But you are. It's a disease like any other. It is nothing. We can deal with it.
Now, Dr. Warero,
yes.
because of the interest of time,
Oh, yes.
I'd like to give you 1 minute, all right, to speak to the Kenyans outside there about hepatitis B. Just have a final word as we wrap this discussion and bring it to a close. Okay?
I would like to say to you that hepatitis B is here with us. It has no cure, but it is treatable. It has a vaccine. You can be protected against the disease. So we beseech you, go out, get tested, and seek protection for yourself and for your family. Protect yourselves, protect your family, protect your loved ones. Thank you very much, Ram.
Thank you very much. I appreciate it. And I wish you the best even as you try to create awareness. Kenyans need to know these things. All right?
Yes.
Thank you very much for coming. That is Dr. Cecilia Warero, a public health practitioner, shedding light concerning hepatitis B and how it is, remember, it is 100 times more dangerous, more infectious than HIV. And she says people really need to take interest because, yes, it is preventable yet incurable. That is the ironical part of it. But now, that is a good place to end the discussion. Remember, keep tweeting. The hashtag is Good Morning Kenya on Twitter. Tag me at Ram Maguko. My colleagues handled at Jane Wambui at KBC Television. Hashtag Good Morning Kenya. Our SMS line is on 20154. Keep the SMSs coming in. Keep the comments coming in. We are bringing this discussion to a close and bringing the show to a close on behalf of everybody that ensure today's show was a success. We wish you a blessed day. May God bless you. May God bless the work of your hands. My name is Ram Maguko. Keep it Good Morning Kenya. Remember, News Check is coming up next. We are still following up on the Aurora and Kim Warero Dam scandal. What next? Will they resign? Keep it KBC.
Okay.